Imagine this for a moment, a silent disease growing inside the body for years, without pain, without dramatic warning, without any obvious signs. Many people feel perfectly normal, until one day they suddenly hear words that change their life forever. You have colon cancer. As a senior physician who has spent decades caring for patients and witnessing both heartbreak and hope, I want to talk to you today about something deeply important, something that can literally save your life. If you are over the age of 45, or if you love someone who is, this message is for you. Colon cancer is no longer a rare disease. It is one of the most common cancers worldwide, and what is more concerning is that many cases are diagnosed late, not because treatment is impossible, but because the warning signs were ignored, misunderstood, or simply unknown. Today, I want to help you recognize the symptoms every adult over 45 should know, not to scare you, but to empower you. Because awareness is protection, knowledge is prevention, and early detection can mean the difference between life and loss. Let us begin with one of the most common and most overlooked warning signs, a change in bowel habits. Many people assume constipation, diarrhea, or irregular bowel movements are just part of aging, stress, or diet. They ignore it, they adapt to it, they normalize it. But medically speaking, a persistent change in bowel habits, especially lasting more than a few weeks, can be the body's early signal that something deeper is wrong. You might notice your stools becoming thinner than usual, almost pencil-like. You might feel that your bowels never fully empty, or you may suddenly start going to the bathroom far more often, or far less. These are not always harmless digestive issues. Sometimes they are signs that a growth inside the colon is interfering with normal function. I remember a patient, a gentle school teacher in his early 50s. He told me he had been dealing with just constipation for nearly 6 months. He tried herbal remedies, laxatives, and diet changes. When he finally came for evaluation, we discovered a tumor that had already advanced. He looked at me with tears and said, "Doctor, I thought it was nothing." This is why we must never dismiss persistent changes in our body. Another symptom many people feel embarrassed to talk about is blood in the stool. Sometimes it appears bright red. Sometimes it is dark and mixed within the stool. Sometimes it is not visible at all, but causes slow internal blood loss. Many patients assume it is just piles or hemorrhoids. And yes, hemorrhoids are common, but assuming without proper medical evaluation can be dangerous. Blood in stool is not a diagnosis. It is a warning. It is the body waving a red flag and asking for attention. Ignoring this sign can delay life-saving treatment. Now let us talk about unexplained fatigue, a symptom that often confuses people. You may feel constantly tired, even after sleeping well. You may feel short of breath while climbing stairs. You may struggle to focus at work. Many adults blame aging, workload, or stress. But medically, colon cancer can cause chronic internal bleeding, leading to anemia. This reduces the oxygen-carrying capacity of your blood, making you feel weak and exhausted. Your body is not lazy. Your body is communicating. Then there is unexplained weight loss, one of the most serious warning signs. Losing weight without trying might sound appealing to some, but when the body starts losing weight without diet or exercise, it can be a sign that disease is consuming energy from within. Cancer cells grow rapidly and demand nutrients. They can disrupt normal metabolism and appetite. Patients may feel full quickly, lose interest in food, or simply notice their clothes becoming loose. If you or someone you love loses significant weight without intention, it should never be ignored. Another important symptom is persistent abdominal discomfort. This may feel like cramps, bloating, gas, or vague pain. Many people live with this discomfort daily, thinking it is acidity or indigestion. But when discomfort becomes a regular companion, when the abdomen feels heavy or swollen, when pain comes and goes without clear reason, medical evaluation becomes essential. Our digestive system is complex, and subtle pain can signal serious underlying conditions. And finally, there is a symptom patients often describe in a very emotional way: the feeling that something is not right. They cannot explain it clearly. They just feel a change in their body, their energy, their digestion, their rhythm of life. As doctors, We respect this intuition. The human body has wisdom. When you sense persistent change, it is worth listening. But here is what concerns me deeply. Many adults over 45 still delay screening. They postpone doctor visits. They wait for severe pain or dramatic symptoms. Unfortunately, colon cancer in early stages often causes only mild signs that are easy to overlook. In the next part, I will share more crucial symptoms you must never ignore. And most importantly, I will guide you through practical doctor-recommended steps that can dramatically reduce your risk and even prevent colon cancer. Your future health may depend on what you learn next. Now let us continue our conversation, because what you are about to learn can truly change the course of your health and your future. In part 1, we discussed early warning signs like changes in bowel habits, blood in stool, fatigue, weight loss, and abdominal discomfort. But there are still several important symptoms and life-saving actions every adult over 45 must understand. One symptom that deserves serious attention is a persistent feeling of incomplete bowel emptying. Many patients describe this in very simple words. They say, "Doctor, I go to the toilet, but I still feel like I need to go again." This sensation can occur when a growth inside the colon blocks the normal passage of stool. The body tries repeatedly to empty, but cannot do so completely. This leads to discomfort, frustration, and sometimes anxiety. Medically, this is not just a digestive inconvenience. It can be a structural signal that needs investigation. Another warning sign is frequent bloating or visible swelling of the abdomen. Occasional gas or bloating after certain meals is normal, but when the abdomen appears persistently distended, tight, or uncomfortable, it may indicate slowed movement of stool or obstruction inside the colon. Over time, this can cause nausea, reduced appetite, and general uneasiness. Many patients try antacids or digestive syrups without relief, losing valuable time. There is also a more serious symptom that often appears in later stages: severe or worsening abdominal pain. This pain may become sharp, constant, or associated with vomiting or inability to pass stool. In medical practice, such symptoms may indicate blockage or complications that require urgent attention. Unfortunately, some people only seek help when pain becomes unbearable. As a senior doctor, I always remind my patients, do not wait for extreme suffering to take action. Now let us shift our focus from warning signs to something far more hopeful: prevention and protection. The most powerful weapon against colon cancer is screening. Many people fear the word colonoscopy, but medically it is one of the most effective life-saving procedures available. During this simple test, doctors can detect and remove small growths called polyps before they become cancer. Think of it as fixing a problem before it becomes dangerous. Screening is not just diagnosis, it is prevention. For most adults, screening should begin at age 45. If there is a family history of colon cancer, it may need to start even earlier. I have seen patients who felt perfectly healthy undergo screening and discover early-stage disease that was completely treatable. Years later, they return to my clinic smiling, grateful that they chose awareness over fear. Lifestyle also plays a major medical role. A diet low in fiber and high in processed meats increases risk. The colon needs movement and natural cleansing through fiber-rich foods such as vegetables, fruits, legumes, and whole grains. These foods support healthy bacteria, reduce inflammation, and promote regular bowel function. Physical activity is another powerful protective factor. Even moderate walking for 30 minutes a day improves digestion, regulates metabolism, and reduces cancer risk. Our bodies are designed for movement. When we live sedentary lives, disease finds opportunity. Maintaining a healthy weight is equally important. Excess body fat can create chronic inflammation and hormonal imbalance, both of which can contribute to cancer development. Small daily habits, choosing stairs, reducing sugary drinks, eating mindfully, gradually build strong protection. Avoiding smoking and limiting alcohol are also medically proven strategies. Tobacco and excessive alcohol expose the digestive system to harmful substances that damage cells over time. But beyond all medical facts, there is something even more powerful: personal responsibility. Your body gives you signals. Your body deserves attention. Health is not something we think about only when illness arrives. It is something we protect every single day through awareness, action, and care. If you are over 45, make a promise to yourself today. Do not ignore symptoms. Do not postpone screening. Do not let fear silence wisdom. And if you are younger, remember this message for your future and share it with your parents, relatives, and friends. Sometimes one conversation can save a life. As a doctor who has seen both tragedy and triumph, I want to leave you with this simple truth. Most colon cancers can be treated successfully when detected early. Many can even be prevented entirely. The choice is not always easy, but it is always worth it. Take care of your digestion, listen to your body, seek medical advice when something feels wrong. And most importantly, value your health before disease forces you to. Your life is precious. Your future is important. Choose awareness. Choose prevention. Choose to live healthier, longer, and stronger.